Well, there's a face-off going on between the strongest hospital system in Pittsburgh, which is called UPMC, and Highmark, the major insurer in that market. Highmark is in the process of trying to acquire the second largest and troubled hospital system in that market. And UPMC says that if they do that, UPMC will no longer sign a contract with Highmark, which means that Highmark's members would have to pay large out-of-pocket fees to use UPMC hospitals and see UPMC doctors.
Well, and Anna, I was surprised, in reading your story, the extent to which consolidation among healthcare providers, hospitals themselves, and HMOs has really taken hold over the last several years. I really thought that these were two separate industries.
Well, traditionally they have been in most of the country, and still that is largely the case, but it's beginning to change. And Pittsburgh is an extreme, but you are starting to see deals that bring together providers and insurers across the country. For instance, United Health Group has purchased some doctor practices, or at least purchased the operations of some doctor practices. They do that through their Optum unit, but it is still part of United Health Group, which is, of course, the country's biggest insurers.
And when interesting when you're looking at your story, you do add some cases of people who feel caught in the middle, that if that contract between the insurer and the hospital is not renewed, that they will lose access to the doctors who've been treating them for care. So when we look at that sort of story and we think about this in a bigger picture, what's going on in Pittsburgh, but also, of course, this conversation that's going on nationally right now, how will this affect patients if this consolidation continues and sort of these battles start heating up between these insurers and hospitals, and how it falls out for the patients?
Well, patients in Pittsburgh are very worried. Again, Pittsburgh is an extreme because UPMC is such a dominant presence. It seems like just about everyone in Pittsburgh sees a doctor or uses a hospital that's in UPMC's network. And they're very worried they're going to lose access to the doctors and the hospitals that they rely on, and they're very upset.
And Anna, is there middle ground for these two sides to negotiate a compromise, or is this thing going to come down to just an absolute falling out?
Well, it's hard to tell. Right now, the rhetoric on both sides is pretty tough, particularly UPMC, which is refusing to sign a contract. Highmark does want a contract to happen. But in these fights, you often find that in the end, there is some common ground. And officials in Pennsylvania are pressing very, very hard for a deal. That includes the governor and some of the leaders in the state legislature. They are also threatening to possibly pass and sign a bill that could extend the current deal between the two sides, just to keep them in cahoots for a bit longer.